My name is Ananda Bandyopadhyay. I'm a Deputy Director for the Polio team at the Bill and Melinda Gates Foundation. Well, vaccines save lives. That's it. If you look into the past centuries, if there is any one tool that has saved more lives than probably only second to safe drinking water, it's vaccines. So that's why, when I was a young medical doctor in India, when I could, on one hand, see the disease burden, the burden of vaccine preventable diseases, and on the other hand, study the vaccines and how they can prevent diseases. That's how I got fascinated. And then, with my first job as a surveillance medical officer with WHO in India, I could again see firsthand the impact of vaccines and vaccination, how they would stop diseases and interrupt outbreaks. It was fascinating. It's critically important that everyone in the world gets access to the life-saving vaccines. First of all, from an ethical and moral standpoint, no child should ever be vulnerable to diseases that can be prevented with vaccines. Second, from an economic standpoint, vaccines are still the most cost-effective tools that we ever had. And then finally, from a strategic perspective, vaccinating the world and protecting the world against life-threatening diseases also indirectly protects the population within the country, because the viruses and the pathogens, they don't follow any borders. So we are essentially serving not only global good, but also our own national disease security with the commitment to vaccines. First of all, eradication is an audacious goal. It really means that we are stopping a disease once and for all, so that we have to never really worry about that particular disease. Polio eradication is feasible. 99.9% of the world has stopped polio. So the proof of concept is already very much there. And with our final push to eradicate polio, which would mean that there is no polio virus there anywhere in the world that could make a child vulnerable for polio paralysis, that would essentially mean generations of children will be protected from this life-threatening and paralyzing disease. And at the same time, it's also, from an economic standpoint, a very important step to take, because if we are able to eradicate polio, we'll probably save more than $31 billion over this century. So from all these perspectives, it's ethically super important, and also economically one of the most prudent decisions to make. Strengthening health systems around the world is a critical component of the polio delivery strategy. And in fact, integration is something that we have been focusing on, integration with other health delivery systems. And if you look into the past examples, the infrastructure that the polio eradication campaigns and the eradication program has built, that has essentially enabled a number of public health responses, including responses to the Ebola outbreak, responses to the pandemic. The early response to the pandemic was mounted in some countries based on the polio infrastructure. And then finally, routine immunization delivery systems remain critically important, the pillar stone of a sustainable health program. And I think that's why the way the polio program integrates with other disease delivery system essentially strengthens the delivery functionalities at a grassroots level. polio free is not polio risk free. And that's the essence of eradication. If we eradicate, then we are not only polio free, but we'll become polio risk free, because otherwise, polio can still be a plane ride away. Vaccines save lives, and vaccines prevent life threatening and crippling diseases. And viruses or pathogens don't discriminate. They can infect and affect anyone and everyone, no matter the national boundaries, the caste, creed, and religion. All that matters is whether or not an individual is vaccinated, immunized, or not. So Americans really have to ensure that not only in our own country, we're upholding the principles of vaccination and protecting against diseases. Some of the diseases are on an upsurge, but probably more importantly, we do that as a global community, because as long as there are vulnerable areas, no matter wherever they are, viruses and pathogens will find their way back. So it's really important both within the country to maintain high immunization levels at each and every corner, but also probably more importantly at the source geographies where there are outbreaks happening and children are getting paralyzed or diseased. We need to act together to stop such diseases. And the good news is they can be stopped. We have the vaccines, we have the tools to vaccinate. The portal of action is the Shot at Life campaign. You can look them up at the shotatlife.org, their website, or follow them on Twitter.